Great talking to you, Nitin, so far. Let's dive into your insights about health tech space in India. And first of all, I would love to know from your viewpoint, where does the health tech space stand today in India from what it was, in the last decade to where it is today?
All right. So that's an interesting question. I actually feel that, and that applies to a lot of startups as well in India. That although, a lot of startups are coming and disrupting, but the problem with healthcare is, and in general as well, that the infrastructure and the development hasn't happened. You can say that we are not as good as developed, as compared to other countries in terms of healthcare. So when we talk about, building some kind of platforms and, this and that, if you consider the basic branches, for example, podiatry, it doesn't exist in India. Then we talk about chiropractors. There are less than 10 chiropractors in India, while in US or other developed countries, it's like a huge thing where there is a big network of chiropractors. If we talk about physical therapists, that also you can say that started to happen. You can say in the last 15 or 20 years, and that's what we see. We saw a massive growth. How the physical therapy and how the physiotherapists changed, and how they grew so well in India. So you can say that right now we are at a stage where startups are coming, but along with the startups, the development is happening a lot in terms of the growth of the sciences as well. Just to give you example, dentistry, which was very basic in terms of when we were kids, like 20 years back. Now dentistry has evolved a lot, and now people actually are looking for the cosmetic options as well. So all these things were happening in, you can say, developed countries, especially US and Canada, about 25 years back. While what we are seeing is that that is being done right now, and we are at a stage where we are actually seeing now awareness is increasing, because at that time the awareness was very low. So that is happening a lot. And in terms of the tech, the technical, the technology aspects go side by side. And of course, if we see the biggest thing that is going to happen in the coming years is that I can clearly see that the doctors, the per doctors, if you see per allopathic doctor in India, of per thousand people is way less than the WHO recommended limit. And right now, and in the future of healthcare right now lies in that how we can decrease the doctor burden, and how we can make the healthcare accessible to more and more people. And another difference which I noticed a lot was that we don't have a primary care in India. We don't have something where if someone has a basic problem, he goes somewhere and then he goes to a specialist. A lot of people are going directly to the specialist hospital. So you can say that right now there are a lot of gaps as compared to the Western countries in India, especially in healthcare. Technology is just playing one part to improve everything. But I would say that the development of primary or basic sciences, like podiatry or chiropractor, or you can say physical therapy, and plenty of other fields are happening side by side. And that education, is necessary as of now if we want to actually, implement health technology completely.
So that's actually interesting. You're saying that there's rapid development from technology as well as from sciences fronts.
Yeah.
But is there a consumer change about being more healthy or making more health choices, or how the health consciousness of Indian citizens has evolved? And
Yeah.
you face it firsthand
Exactly.
when you're dealing with patients. Like,
Exactly.
where do you see that? Where is that today in
Yeah.
comparison to 3 years
Exactly.
ago when you started?
Yeah, exactly. See, that's the whole point. That's what I'm saying. That thing is increasing a lot, and that's the whole awareness part, and that's continuously increasing in India. Because as you already know, India is a population where less than 27 years of age is like the median population. 27 is the median age over there. So a lot of people, are very young, and they are constantly looking into good options for accessible healthcare and for improved healthcare. So that's what I saw as of now, that the awareness is continuously increasing and people are looking for healthier and good options. It's not like so that's what it is. And secondly, with the emergence of all the mobile phones and data and everything, People are good enough that they Google out all the problems they have. They are able to actually do a primary diagnosis, which a lot of doctors don't like it, but yeah, it's happening. The first thing anyone has any problem, they first check, they Google it, and then they go for the right option. So that is happening. Awareness with the help of technology, I would say it has changed the whole game.
So you are at the technology forefront, and this is where your thorough understanding of the field comes into use. Is that healthcare is rapidly growing? Where do you see health tech and healthcare in India evolving into over the next 3 to 5 years?
Okay.
What are some of the frontiers that would emerge and become more foundational and so forth? Like what's your take on that?
So my take on this is that the first thing that is going to happen, although I can tell right now, we after 5 or 6 years, or you can say maybe couple of years down the line, there is going to be a huge doctor crisis. I mean, that's what I feel, that because doctors are over there, as compared to the population, the ever growing population, the number of doctors are very less. And if we talk about rural areas, especially where there is no access of healthcare, I feel that they are suffering as of now. How the technology is going to play that part, it's still to see, because then right now it's still limited to the healthcare is still limited to all the video apps, all the video chat, everything which is happening. It's still limited to the English speaking population, which is you can say, which is just the metro cities. But when we talk about the tier 2 or way tier 3 cities, where there are actually no doctors, where they have to travel 25 or 30 kilometers just to have access to a doctor. So that is where I would say that there is going to be a massive need. And that's where we see that how the healthcare or maybe technology can play a part. So I think that there is a lot of going to be a vernacular apps, and there are going to be a lot of players who can access to the tier 3 or tier 2 towns, and help them out figuring out that how they can access better healthcare. Because everyone from tier 3 town coming to AIMS or all the big institutions is not something which is a good solution, where people are just in a queue of at least 2 or 3 kilometers every big hospital. So that is something which I feel is going to change. Second thing is which is going to change is that a lot of medical medical products which are already there, a lot of the off the counter products will also come. There is going to be decrease in cost, and there is going to be more consumeristic approach for buying things which can actually prevent. The preventive healthcare is also going to grow very very fast in the coming years, because everyone has realized that prevention actually is better than cure. And we've already seen the adverse effects which happened in the with the chronic diseases like diabetes and multiple other hypertension. So that's where I see the preventive market, the rural market, and the market for growing medical products which can prevent things is going to definitely grow.
Wow, that's a lot of change coming, man.
Yeah, yeah.
Yeah. So, Nitin, I had a question. So you made a very interesting point when you said that, the consumer is becoming more aware. They do a lot of search before going to a doctor, and hence they know, they already have some background and some
Yeah.
context before they go into a doctor, right? So how do you, with the advent of ed tech and a lot of technology coming in, how do you see the patient-doctor relationship evolving from what it is now?
Okay. So see, right now, I would say that right now, the how the doctor patient relationship is, if you talk about India, like as a country, then I would say that as far as I have experienced, that doctors actually right now they try to resolve as many problems of the patient. And even if the patient is coming, that I know that all the patients are active on WhatsApp. So right now, they are asking doctors all the things unofficially as well, and everything is there. So right now, first of all, the communication is a big challenge. Right now, if we talk about just communication, it's like it's free of cost for the patient and doctor, and that's happening very very often. That's where it changed the whole game. Right now, earlier, doctor usually the patient has to call, or patient has to take appointments. So I would say that another online consultation would definitely increase in the coming years. That's where I see the relationship would change. Second thing is that it will be simplified a lot by the tech, because right now, all the reports and everything which is there, and all the follow-ups, they are not actually, you can say, organized very well. The whole thing is very, very unorganized. But right now, the efforts are being made, because unfortunately, I don't have a very good answer in this space, because this depends a lot on the uh, organization of the hospital, organization of the clinics. Because so far in India, unfortunately, we have failed to make the data centralized, while US has Epic system and a couple of other big data companies which have put everything linked to a patient. Everything is there on a system, and the whole data is there. In India, as of now, still, even after so many startups, and even after 13 years emergence of one of the biggest healthcare tech company in India, we still are not able to solve the problem of data, which is a digital data. We are still, everything still on paper. So I actually personally believe that that is the that is still needs to happen, and which can change the whole patient relationship, doctor patient relationship, magnificently. And also it will give a lot of all the background of the patient very, very fast, but that is still to happen. And besides this, I would say that it's basically, with the technology, it's continuously changing, because now they are more connected to the doctor, and that was not happening before the emergence of tech. So with all the communication apps and everything, I think it's going to evolve much better.
Thanks. So I guess, I mean, the idea is that the patient doctor interaction is going to get a lot more
Yeah,
seamless
yeah,
as we
yeah.
go
Right,
forward.
right.
That's really interesting. Uh, One thing that I was wondering is, as you were talking, you mentioned that in the Western countries there's a lot of focus on basic sciences, and a lot of fields exist in the Western countries which do not exist in India yet. Which got me thinking that there's also a problem in the healthcare system of the Western countries, and that is cost. Right, the cost of treatment is usually very, very high, and sometimes it is even prohibitive in nature. So, is there a way health tech can alleviate that problem in India as we grow in terms of specialization, but still containing costs?
Okay, so so I would say that there is a lot of misconceptions about specialization. So if we talk about the specialization, like even podiatry or chiropractic, so the funny point is that these specializations and whatever it exists, these actually reduce the cost, because now we are talking about knee surgeries which can be saved. Now we are talking about people going into, if they have someone like bone problems, where they are going to lie in the hospital for 10 days, which something which can be prevented or adjusted by the chiropractor in just few hours. That's where I'm saying that those things which, if the basic sciences or specialization, if they come to India, that is not going to increase the cost, but that is going to actually decrease the cost, because then you have more patients who are actually going in their later stages of life, being saved earlier, before they actually enter into it. So consider the rise of surgeries, knee replacement surgeries in India. It's actually, if you actually check out, it's nearly an exponential curve. So why this is happening, if we had like some basic and specialized sciences which were there, which could actually prevent it, I think it would have been a much better approach. But anyways, I feel that is going to happen a lot with the consumer. The bigger the market and where market grows, then people usually ask, that this is what we need. And that's what I saw. If you actually check out 15 years back, people, or 20 years back, people didn't know about physical therapy. They used to think that that is not actually a science. But now people, if they have pain or muscle issues, they first go to a physical therapist. And that's what the whole change has happened, because as a society, the market is going to give what society needs. So I am very positive about that's how the whole specialized fields are going to grow.
That's very insightful. So the point is that healthcare will allow people to diagnose problems at the very early stage, so that costs related to
Yeah,
later more
right.
complicated procedures can be saved.
Right, right. So exactly. So that's what the Western specializations they have made. That's where it actually helps out, because then you're able to diagnose it earlier as compared to going at a later stage of surgery and giving it out directly. Your leg or everything to the surgeon that this is the end stage. So that's where I feel that that's how it's going to happen if we actually reach out early.
Thanks. And that's a very interesting perspective.
Yeah.